So we've been working on that project for good 3-4 years now. It started with direct enhanced service where practices were offering transactional services, booking appointments and ordering prescriptions to many patients. And then we felt that it needed another push from our end, from CCG end, to encourage practices to offer more and more services to patients and encourage the number of users.
The Transforming Primary Care programme has been working closely with local area CCGs and practices to deliver a patient online programme to patients.
And we have been working with patients right from the beginning, because we wanted to really know what they wanted from us, what would be good for them, and how they wanted to hear about the services that were on offer.
We provided and did a business case for funding, and this is given to each CCG, who had a project team that worked on providing assistance across London to increase patient registration, which is now at 1.7 million for Patient Online.
Implementation team work with GP practices across London to help them meet their agreed aims. We also act as a conduit for shared learning, innovative techniques and new ideas on how best to implement these services for patients and the public. We do this by working with individual practices where helpful and appropriate, clinical commissioning groups across London and the London-wide local medical committee. Because we're a national team, we're able to draw upon learning from across England and also share the expertise of London practices.
In terms of knowing about the service, I mean, we offer loads of tools for practices, so they can promote it locally, they can advertise it in the waiting room, on the phone lines. There is a communication toolkit they can download with template press releases, template tweets, messages that can be sent when reminders go to patients about their appointments. And they are all free. They can be downloaded from the DH order line, so anybody can get as many of these materials as they need.
Again, we incentivize practices. Well, we had the idea to actually incentivize members of staff, but it wasn't in line with the governance, so we couldn't pay by voucher to members of practice staff, so we had to incentivize practices with the recommendation to organize a little team away day, team building or dinner or something like that for the staff who really make this happen.
And then secondly is signing up patients when they turn up for their appointments, because we know from experience that it works best when they are face to face with a member of the practice staff. The receptionist, the nurse, the GP. And that's the right time to actually offer these services and complete the whole registration process. So patients leave the appointment, leave the practice with their login and their password, and then they can use the services from there on.
And obviously I supported practices with webinars and workshops and on-site visits and going through configuration and trying to take them on board, which was quite easy with some practices. It was a little bit more work with the others, and it was sometimes impossible with a few, which is always the case.
I feel that there is a lot we can do to transform the way that we deliver services to patients. We've seen a lot of benefits in both the banking, airline industry, particularly around the way that we interact with the services. And I believe we can bring some of those benefits into primary care.